was definitely due to the vaccine because of the fact that he had been born with perfectly formed kidneys.
I found, particularly in Aboriginal children, but also Caucasian children, if they had even a simple cold, or if they'd gone through a series of simple illnesses recently, or if their nutritional status was not really as good as it should have been, if they were vaccinated, the result could be fatal. I went to Melbourne to give some lectures about this problem, and I was away, I think, for 5 or 6 days. A doctor came to relieve me. I carefully explained to him that under no circumstances should he vaccinate sick Aboriginal infants, even if they had a simple cold. Now, when I left town, I won't use his exact words because they were rude, he actually said to some of the citizens in the town that he did not believe in my theories, mind you, he said, not my observations, and he had no intention of carrying out my methods of practice. He saw one Aboriginal little boy, the best cared for infant in the district, white or black. And this boy had an upper respiratory tract infection. He gave triple antigen. The child died. He saw a second Aboriginal infant, a little girl, who had mild diarrhoea. And he obviously thought, well, that first case was just a coincidence, had nothing to do with the vaccine. He gave triple antigen. I came back to Colorado and I found that little girl dying in the bed.
And Cottes researchers at that time thought that these babies were dying because there was something wrong with their breathing controls. So they concentrated on breathing. And some parents opted for monitoring their babies' breathing at home in an attempt to prevent their children dying from Cottes. The alarms happened after a host of stressful events, like incubating an illness. A night or two before the runny nose appeared, babies had a cluster or two of alarms. So the alarms preceded the onset of symptoms. Overtiring day, long shopping trips, and car trips and things like that. But the vast majority of alarms happened after vaccination. That was at the time when we didn't know anything about the controversy surrounding vaccination. Indeed, some 40 years ago, I had my children vaccinated. And with the first child, we didn't even link that stream of ear infections, recurrent ear infections, bronchitis, and generally chronic ill health to the administration of those vaccines. I don't even know what vaccines she was given. It really took research into babies' breathing, almost 3 years of research before we looked at each other with my late husband and said, vaccines are killing babies. Indeed, it is the clustering of deaths and clustering of flare-ups of surge breathing that constitutes a truly scientific evidence of the causal link. But of course, when you study these papers dealing, for instance, with Tennessee deaths or other deaths after vaccination, they say that there was an unusual clustering of these deaths, but it does not constitute evidence of the causal link. And yet, all their data are showing the same clustering. These are the so-called Tennessee deaths. Between 1977 and 79, large numbers of babies died so many days after their first triple antigen injections. And here you have got 41 babies who died within 20 days. And the interesting thing is that you see clear clustering of these deaths along the same critical days as we recorded in breathing of babies after vaccination. It stands to reason that babies would die more often, or more babies would die on those critical days when any baby has a flare-up of stress breathing. And again, here you see a truly scientific evidence of the causal link between administration of those DPT injections and the Tennessee deaths. Here you are looking at a record of breathing of 9 babies. Every color represents one child. And this is day 0. You can see a number of days before vaccination, no stress level in breathing. There comes the injection, and you can see the 48-hour flare-up. You can see the flare-ups in between. And look at the delayed reaction all of those babies had a delayed reaction. And even those babies whose mothers recorded no response at all, here down the bottom, even those babies had slightly increased stress level along the same days as those babies who reacted quite a lot.
In 1975, when Japan ceased vaccinating under 2 years of age, it immediately jumped from 17th place to the lowest infant mortality in the world. 13 years later, it lowered the minimum vaccination age to 3 months, and the trend then immediately reversed.
He'd stopped breathing. The doctors then grabbed my son Dylan, took him away, and about 5 minutes later came out and said it was nothing but a heat stroke. Everything was fine. They just observed him for a couple of hours, and then they assured us it was all right to take him home.
And yet, when we look at the symptoms that we see in a child who has been vaccinated, high fever, high-pitched screaming, floppiness, sometimes even a weakness and almost a hemiplegic situation in some cases. These are symptoms that if they were seen in a child who had not just been vaccinated, all us doctors would be a little concerned that this child perhaps had a type of viral meningitis. We wouldn't simply sit back and say that's fine, take some Panadol and it will go away.
We'd totally forgotten about what had happened the first time. We didn't even relate it to ourselves. The doctor administered the shot, we left the hospital, we got into our car. The moment we sat in our car, Dylan started convulsing. This time it was just rapid convulsions. He was just jumping in our arms, literally jumping. His eyes rolled back in his head, he stopped breathing, his lips went blue, and he went limp. He just went limp. We raced up to the hospital and we said, look, what is happening to our child? This is twice now. Each time he's had an injection, he has had a severe effect. The doctors said, come with us. They took us with us. At the end of 24 hours, they finally told us that Dylan had meningitis and it was nothing to do with the vaccine that was administered to him moments before his apparent convulsions. That was the scariest moment of my life as a parent.
We don't know enough about how stresses affect the body. It's interesting with the first MMR vaccine that came out in New Zealand, and I think definitely also Australia, we had the so-called Arave strain of mumps in it. Now the Japanese did lumbar punctures and they proved that this particular mumps vaccine caused meningitis in a significant number of I think 1 in 600 recipients of the vaccine a month later. You try to go to your GP and tell them that what's happening to your child now that's used a vaccine in month 30, he'll laugh at you.
You often hear, of course, that when a child develops encephalomyelitis, brain damage, or dies after vaccination, that was coincidental, it was not caused by the vaccine. And there is no evidence of the causality. Well, that's not true. 1985, a Japanese Journal of Medical Science and Biology published this article. And they say here that administration of pertussis vaccine causes a variety of untoward reactions in children. The most distressing reactions are encephalopathy and neurological disturbances, which have occasionally been observed and in rare cases produce severe brain damage and even death. Such unfortunate incidents have frequently lowered the acceptance rate of the vaccines and have even brought on vaccination boycotts. Well, you often hear that actually we have to prevent children from getting measles because we want to prevent this degenerative disease of the brain, which is often linked to measles virus, subacute sclerosing panencephalitis. However, this article says that actually children who never had history of natural measles but were given measles vaccine also developed SSPE. So, vaccination is not preventing SSPE. This is another article which says the same thing. This is published in JAMA, Journal of American Medical Association. Panencephalitis following measles